I'm Erika Kurtzen. I'm a TRE practitioner. I've been doing it for 2 years. At this stage, I'm an L3 trainee, and I love working with TRE. From a medical background, it's just helped me so much to help people that I actually felt I couldn't do a lot or just actually treat their symptoms before. The interesting thing is that we've been doing it as a family. I've got 5 children, and my husband's a dentist. 3 of my kids are in the medical profession as well. 2 are occupational therapists. The other one is a medical doctor at this stage, still doing an intern year. And so we all incorporated in our different medical practices, and because we've been doing it as a family, it really made a huge difference in all of us. I think we just found that the whole family dynamics changed, and we just feel that we're all less stressed, and it's opened up new dimensions for us in our family as well, just to do what you really want to and follow your dreams. Medically wise, for patients, I use it for patients that's got epilepsy. Most of the time, patients with epilepsy will say they know that stress is a trigger. So we make sure that they're fine and that they understand it, and basically after 1 or 2 sessions they'll already say that it's better, I feel better. One of my patients' epilepsy was out of control, and I mean it wasn't controlled even with 2 or 3 medications that the neurologist has put him on, and after 2 sessions his seizure stopped completely, and he's been without a seizure for a month. I worked with him, quite recently, and he's really doing very well, up to the point that he actually feels safe to do it at home by himself. I've been doing TRE with patients with rheumatoid arthritis, finding that the wonderful thing is that actually after been doing it for 3 to 6 months, we do blood tests again, seeing that the rheumatoid factor and some of the other indications that we've been doing it actually came down, and they feel much better. Stress is also a huge factor, but they also find that their joints and things are loose. So I teach them to self-regulate. If they've got pain, they slow down, but they find that their movement has increased. So I think it's really been helping with patients with that type of diseases or illnesses. Fibromyalgia as well helps a lot. Patients find that their headaches are better, the muscles feel much better, and pain is less. I find that for people with allergies, it's great. By doing TRE, it controls that, because it seems like there's just a huge response to the immune system if you do TRE. Some of the things we can't really explain why, but patients that definitely find that their symptoms are much better. We've been doing it with a child that's autistic, which is one of the wonderful patients that we've been doing it with. I work with an occupational therapist, but he's completely changed. He's about 27 years old. His aggression is much better. It's like he's much more integrated. He can follow directions much better. He can actually do it on his own as well at this stage. He just loves it, say it's his exercises. But his mother can actually take him to town and sit down and have coffee with him. He can do simple tasks that he's never done before, like set a table and put flowers in a pot. He's much more creative. He started singing. That was one of the wonderful things that he's been doing, and he started to paint. So we really think that it's made a huge difference in his overall, not his aggression alone, but just his behavior and the things that he can do. It's difficult to think. Often you start to think about all the other lovely things that's happened and patients that benefit from it. One of the patients that really TRE helped a lot for was a patient with Meniere's disease, or Meniere's. I mean, she's had attacks once a month, sometimes more than that, and it's really debilitating because, I mean, you can't get up. You're nauseous, you're off balance, just lying down. Sometimes for a day or 2 was really not nice. Nothing really helped. She was on medication. They wanted to do an op on her, which is very drastic, and they could actually say, I mean, if they do the brain op, the success is only 40%. And she's been doing TRE now for about a year and a half, and I think in that time she's only had one relapse, and it wasn't as bad. It was actually just a day that she was lying down, but she wasn't even vomiting. So to her it made a huge difference. I think what I can say, just to as a summary, that I try TRE with all my patients, from chronic headaches to minor things to chronic diseases and cancer patients as well. And I've never had a tool that I've done lots of other different things that I studied as well, different natural medicine modalities as well. I've never had a tool that really meant that much, because it's so self-empowering and the patients can do it themselves. And I usually find that after 3 months, symptoms are much, much better. Thank you.